The next question we have right here. Which of the following complaints reported by Richard, 40-year-old who underwent transsphenoidal hypophyseectomy 3 days ago, needs essential follow-up by the RN? All right. Option one, some discomfort when trying to chew the food. Option 2, complaints of mild headache since the procedure. Option 3, concern about the oral hygiene since he can't really brush his teeth for another week. Option D, no bowel movement since surgery, even though he reported trying every day. Now, in order to answer this question, we also probably need to know what is transsphenoidal hypophyseectomy. Well, not always we may know what all these things are, but let's try to identify, what is hypophysis? Hypophyseectomy, what is hypophysis? Hypophysis is another name for the pituitary gland. Okay, so it's a surgery involving the pituitary gland. So we know pituitary is in the base of the brain, right? So above the nasal area, that's where the pituitary gland is located. So this patient who's undergone the surgery above this nose at the bottom of the brain, what's the priority? So some discomfort, so essential follow-up. The question is asking for essential follow-up. So option 1, some discomfort when trying to chew the food. Okay, some, okay, not severe. Now, we need to understand this is surgery involving the base of the brain. Also, the surgery has access through the nose or through the mouth between the upper lip and the gum. That's where the access could be a lot of times. And so is it possible to have some discomfort? Those who know the content, you will understand yes. So it won't be the priority. Now, option 2, complaints of mild headache. Okay? So mild headache, again, look to see, followed by the procedure, site information of the surgical site, won't that possibly cause some headache? Which is a mild headache? It can. Okay, again, look at the keyword. So mild, this was some. And for that reason, 1 and 2 are not the best one. Now we are left with option 3 and 4. Option 3, concern about the oral hygiene since he can't really brush his teeth for another week. Okay, so while it's important to keep the hygiene, can't brush it for 1 week. Will that be dangerous? Won't we have other ways to keep the oral hygiene? Maybe gently rinsing the mouth, right? Possibly, right? Versus option 4, no bowel movement since the surgery, even though he reported trying every day. Now, this happened. The surgery happened 3 days ago, and for this last 3 days, this patient is training every time with the bowel movement. Now, remember, this is a surgery involving the base of the brain, or we can say it's a part of the brain. So after a surgery of the brain, if the patient is training, won't that cause too much pressure at the surgical site and leading to complications? Those who think right, those who know the essential content, you will understand that's a possibility, and therefore our answer become option 4. Yeah, so no bowel movement since the surgery, even though he reported trying every day. And as we guess, our answer become option D, right? So that's what the transsphenoidal hypophyseectomy is. Now, as I told you, so even though we don't know the content essentially 100%, you can still identify the problem from the keywords. You can do the elimination from the keywords. The words, the some, the mild are not as concerning as the patient is training for the last 3 days, and therefore that become our priority